It's the essential part of the first in Russia comprehensive cancer center, boasting a full range of cancer care services, including state-of-the-art radiation therapy department, nuclear medicine PET center, Department of Diagnostic Radiology and Minimally Invasive Diagnostics, Department of Clinical Oncology and Palliative Care, and Department of Oncologic Surgery.
EMC is one of the largest private centers in Russia. Now EMC has 5 locations in Moscow, and every year we are getting almost 300,000 patients. Now we have complete set and complete services for oncology care, which include chemotherapy, diagnosis, CT, MR, prevention, pathology, PET, radiation therapy, everything. The reason for this is that Russia has incomparably high rates of cancer frequency and incidence and mortality. The problem is that in Russia, mortality from cancer is much higher compared to European countries, to United States. And the coverage of Russian population by screening programs is much lower compared again to European countries. Patients, the risk of dying from cancer, general risk in Russia is about 60%, which is higher again compared to European countries. And patients are searching for the best treatment options here in Moscow or in other countries.
What's very important and unique is that EMC Nuclear Medicine Center is integrated within the Oncology Institute and into a multidisciplinary team from Europe, Israel, and United States.
EMC is called European Medical Center not just because of marketing purposes. This is in fact European center, but located in Moscow because of the doctors who work here. We have many doctors from abroad working in Moscow. We have a lot of doctors who have been trained in Russia but had practice abroad, and they also work here in Moscow at EMC. So we have really international team.
One of the very difficult step of treatment in radiotherapy is the time issue, because patients usually should come to the hospital and stay for 1 month, because radiotherapy is giving in fractions on a daily basis. So it's not like a surgery when you go to Israel and you have the surgery 1 day before, so 1 day after, then you leave back to Moscow. You should come there, you should stay there for 30 to 40 days, and it's very difficult because usually patients need the support from his family, so they leave their family here, they go to Israel. So the idea beyond opening this center in Moscow actually is to bring serious medicine and the caring staff in Moscow.
I must say that what is happening is like a miracle here, and I think that the miracle was done by Mr. Scheiman, who brought dreams to come true. And to think that it was established in less than 1 year, it's unbelievable. And absolutely, in terms of facility, instrumentation, and design, this is comparable to what we see in other countries in the world, in Europe and also in the US.
Of course, all the equipment by the companies from Philips, from Varian, from IBA is the best of its class equipment, which also operates here.
As member of IBA, I have had the pleasure to work and collaborate with HealthMed company to install particle accelerators here and lab equipment also to be able to produce the FDG in order to treat patients. And I think that the success of this project in such a short time is very, something that makes me proud of participating to, because in the end I can already see today the patients coming in and having the right treatments to help them in the future.
We at HealthMed has a lot of experience in building medical centers all over the world, and our main suppliers in all our projects are the biggest medical facility and medical equipment providers like Philips and Siemens. We are working based on global contracts, and of course we know how to lower the cost to build such department. Our experts, especially in oncology area, well known all over the world, and they are bringing the idea of how to operate and how to make the oncology department as profitable as possible. From our experience, the relationship that are usual in Russia between the providers of medical equipment, the suppliers of medical equipment, and the hospitals are just based on the equipment, and that's it. We're providing not only the equipment, most important, we're providing the training for the personnel. We have trained in Israel based on different hospitals, a lot of EMC doctors, physicians, and people that involved in oncology department. Also, after the opening of oncology department, we are going to support the ongoing service of this department, and this is the different way of thinking and different style of relationship between the supplier and the end user.
У меня нет никаких сомнений, что введение в строй отделения ядерной медицины, в частности, отдела ПЭТ-КТ, выводит Европейский медицинский центр на первую линию фронта в борьбе с онкологическими заболеваниями. Этот уровень, он, безусловно, международный, причем не просто международный, а высокий международный уровень.
In this department we have the most sophisticated variant machines, which is Trilogy and TrueBeam. And actually this allows us to simulate patients and treat them with the newest technology ever in the world. And actually this gives us an option to look to the patient in what's called a three-dimensional image. So we choose here the organs that we want to treat. As you see, this is the two brain lesions for the patients. And as well, we delineate the organ, so we call it organ at risk. For example, left eye, right eye, and in some cases we delineate the chiasma, which is the organ is for the nervous system. And from here, you might choose the right way to give radiotherapy to the patients, trying to give higher dose to the tumor itself and to avoid irradiating organ at risk. No radiation oncologist, even 10 years ago, believed that he could give a good dose to the brain, to the tumor, avoiding this vital structure like hippocampus. If you just look in one view of this image, you might see that while giving radiotherapy by this technology, using this sophisticated technology for the treatment, giving 180 fields at the time, while in the past we give only two opposite fields, we call it left lateral, right lateral, and by there we irradiate everything. We irradiate the hair, we irradiate the vascular apparatus, we irradiate everything. So a patient got treatment with a lot of complication. Just thinking that you might give radiotherapy to this brain tumor, avoiding giving it to the eye in this special case, and avoiding giving it to the hippocampus, it's actually a very good achievement. We didn't even dream about it 5 years ago.
Nuclear medicine and positron emission tomography coupled to fluorodeoxyglucose, to FDG, really changed the treatment approach of patient. And I'm pretty sure that thanks to FDG, PET, and nuclear medicine, oncological patients get the best treatment today. And this approach of diagnosis of molecular imaging contribute to our knowledge, to the treatment of the patient, and to the benefits of the patient. Absolutely.
Она анализирует функцию болезней, их метаболизм, их обмен веществ. Поэтому, используя эти средства, мы можем точно знать, как болезнь себя чувствует, каков ее обмен веществ и насколько он подвергнут влиянию того лечения, которое мы даем пациенту. То есть контролировать лечение больных мы можем с очень большой точностью, используя эти методики.
Very accurate diagnosis is key to optimal patient management of oncology patients. PET-CT has synergistic advantages over PET or CT scan alone. So before we had our own PET-CT, we had to send our patients abroad for imaging, and now no longer.
We see a lot of patients traveling abroad every year to get cancer treatment in other countries, in Israel, in Germany, in Switzerland, in United States, everywhere. And we have decided that we need to build the facility here in Moscow with radiation therapy, with PET-CT, with cyclotron. And we are attracting the patients by the most sophisticated and most modern standards of care, because people know that we have foreign doctors working here. We work according to the European and international standards of care. We have the best equipment you can find, and people come to EMC to get the best international health care here in Moscow. So there's no need to go somewhere else. It's available here in Moscow, and that's wonderful, because there's no other center like this which has all the modalities, including own radiopharmaceutical production.
Cancer patients usually suffer from their disease, and we don't want to add more complication of their treatment, flying to other countries, backing from there, and actually the language barrier sometimes is an issue. So we try our best to build a very comprehensive, sophisticated radiation oncology center in the middle of Moscow to be able giving the best care possible here in your home.
Сегодня пациент, болеющий онкозаболеванием, может получать все виды лечения у нас, и ему не надо останавливаться в середине лечения и искать продолжение лечения в других больницах. В связи с тем, что количество онкологических больных у нас увеличилось значительно, нам очень важно преемственность лечения здесь, у нас, потому что это лечение происходит под нашим контролем. Поэтому сейчас мы можем быть, простыми словами сказать, спокойны за судьбу наших больных. Что судьба наших больных находится в наших руках, профессиональных руках, руках, которые помогают больным на самом высоком международном уровне.